Absolutely, I couldn't agree more. I mean, as the person that did the mastectomy alone, even that is a big surgery to, especially if done right according to the techniques that you and Dr. Stolier and Dr. Allen and everything. I worked together to learn how to really find that plane using magnification loops to make sure that I got the right tissue out. Well, that alone, even in a small breast, it takes about 45 to an hour to get that out. And a much larger breast, it can take 3 to 4 hours. So that's just part. So, and with a microsurgery, for instance, a person can be on the table for 12 hours, even in the best hands, right? It's a very, very complicated surgery. So
Yes, it is.
it's
I mean,
not a breast implantation.
yes. So I think there are trade-offs with both sort of types of surgeries. With autologous reconstruction, that's kind of the technical term, but when we talk about it with patients using kind of your own tissue or, maybe natural reconstruction, although I think implant-based reconstruction can also be natural. So I would say is using your own tissue is obviously a much more complicated procedure. It does require a longer recovery because the patient's not only recovering from the breast sort of area of surgery, but also from the donor site. So that's something to consider. And then we're essentially transplanting tissue. And when you do that, you're really mainly looking at blood flow. Tissue only lives when there is good blood flow. And in order for us to restore blood flow, we have to connect two very, very tiny blood vessels together. They are maybe 1 or 2 millimeters, so just like a little bit like bigger than a pencil tip. And then we actually suture them with sutures that are thinner than the tenth of a human hair. So you can imagine that we really need loops and a microscope to be able to see sutures that are that small.
Right,
But
right.
what we utilize is those sutures to connect blood vessels together and so that we can restore blood flow. And then over time, this tissue heals in the breast and it becomes a part of the breast. So once the healing process is over, that breast really feels much more natural, like a natural breast. You can lay on the breast, it gains weight with the patient, it loses weight with the patient. So it really acts like tissue, natural tissue in the new breast location.
Yeah, I think
Um,
that's a great answer. And you've also explained why it's called microsurgery. A lot of people don't understand, why is it microsurgery? Why do you need a specially trained physician or surgeon to do this? You just talked about how dissecting out this very, very tiny vessel, a fat particle is based on that vessel. And then that fat particle plus its vasculature, and now we're talking about an artery and a vein, we're talking about inflow and outflow, that has to be then dissected out of the chest and reconnected. So it's all quite complex.